All right, Jamie, it's great to be talking to you. I wanted to just give you a quick second to tell everybody about yourself and your background, what you're passionate about.
Yeah, hi everyone. I'm Jamie. I'm a registered dietitian. I live in New York City. I'm super excited to be talking with you today. I'm super passionate about helping people make just small changes to their diet to make them feel better, reach their weight goals if that's something you have a concern with, and overall just like figure out how to live really well and eat the best way you can.
Awesome. And I know, Jamie, you have passion specifically for how diet affects mental health. So I'd love to ask you, what are a couple ways in which our diet directly affects our mental health?
Yeah, so there are certain foods you can eat, like things that are high in omega-3 fatty acids. So foods like salmon, fatty fish, a lot of nuts and seeds have these properties that help increase blood flow to our brain. So help you sort of think and process faster. And also there are foods that are rich in your B vitamins. So B12, folic acid, thiamine, all the B vitamins that are needed in neurotransmitter production. So eating foods that are rich in these B vitamins, so spinach, um, eggs, milk, dairy products, they are really great to sort of increase how many neurotransmitters your brain is making. And those are related to our happiness neurotransmitters.
Awesome. That's great. And I'll do a quick plug. Kasacha Inchi is high in those omega-3s too. So awesome. And what are some ways specifically in which, I guess, your favorite ways to get protein and fiber into your diet at every meal?
Yeah, it can be a challenge, right? So for me, just starting off the day with something like Greek yogurt, eggs, and adding things like nuts and seeds, they're super easy for me. I'm on the go. So having those sort of like in my bag, sort of, have a quick bite at work, that's really important to me. And if I have more time during the day, sort of adding vegetables where I can. So making half my plate non-starchy vegetables, especially at lunch and dinner, really important for fiber. And then protein, I always try to build my meal around a lean protein, whether it's nuts, seeds, or, your standard chicken, fish, tofu, things like that.
That's great. And I know you also work specifically with sort of a concentration, or one of your concentrations is diabetes. And this is something that runs in my family as well. So I'm really curious to get your thoughts on misconceptions around diabetics and diabetes and the ability to enjoy basically anything sweet.
Yeah, so I have a big interest in diabetes, both sort of like type 1, type 2, and gestational diabetes. When people hear the word diabetes, they think like you cannot have any sugar, which is not true. So when it comes to eating and adding sweets into your life, you just want to make sure that you're pairing food properly. So adding fiber to that. So if you're going to have some ice cream, making sure that at dinner or lunch before you have a high fiber, low fat meal. So that'll help with your insulin spike, and also making sure that you're eating adequate protein and fiber throughout the day. So that'll keep your blood sugar stable, and allotting for those carbs, sweets that you're going to eat at that mealtime. So really sort of planning out your day, but you can definitely enjoy sugar. And there's ways that I work with patients and clients all the time to make sure that happens.
That's great. Great news and helpful. The last question is my favorite question to ask, which is just, what is something new you've learned recently about health and diet that you've embraced wholeheartedly?
Yeah, so this is a personal question for me. I've really been working on my sleep hygiene. So the research continues to show that if you get poor sleep, it increases your cortisol levels, which causes you to wake up in the morning feeling stressed and sort of crave those high sugar, high fat foods, which then sets you up for like a quote unquote ruined day throughout the day. So for me, it's really figuring out what has been helping my sleep. So whether that's, getting my phone out of the room, drinking a cup of tea before bed, or just like trying to meditate and wind down. So sleep hygiene is something that I continue to come back to in my personal life and for everyone else who I talk to.
Yeah, I love that. I'm trying to do the same. I think everybody is thankfully realizing, I guess, that quality and and the right quantity of sleep is super important. So that's awesome. Thank you so much, Jamie. This was really helpful and insightful, and appreciate you coming on with me.
Yeah, thank you so much.